Secondhand smoke after Asian eyelid surgery? About 11 days post-op, I went to a small get-together with a couple of people who smoke. I made sure to avoid them while they were smoking as much as I could. I did not drink or smoke myself. I noticed a decline in the speed of my healing, but I'm not sure if this was in my head. Does secondhand smoke really play a huge role, and what exactly constitutes as secondhand smoke? Would being in the same apartment but different rooms as a smoker mean I am exposed to secondhand smoke?
Thank you for your question. You stated in your question that 11 days after surgery, you went to a social gathering where you were exposed to secondhand smoke, and that you are concerned that there may have been a change in your rate of healing. And you're asking about the effect of secondhand smoke and what level secondhand smoke is significant depending on your location relative to the source of the secondhand smoke. Well, I can certainly assist you with this question. A little bit of background: I'm a board-certified cosmetic surgeon certified by the American Board of Cosmetic Surgery. I'm also a fellowship-trained oculofacial plastic and reconstructive surgeon, trained through a fellowship sponsored by the American Society of Ophthalmic Plastic and Reconstructive Surgery, and in practice in Manhattan and Long Island for over 20 years. And eyelid surgery is an area of specialty, and particularly Asian eyelid surgery. So the question about smoking is a very important question to any doctor who performs cosmetic surgery. And it is no secret that smoking has an impact on healing. But in your situation, we can certainly temper that by understanding exactly what the phases of healing are. There is a lot of concern for patients about potential for poor healing or for thickened scars, or keloids as is often referred to, when it comes to healing of eyelid surgery. So to understand wound healing, let's start by just understanding the phases. There are basically three phases. There's an inflammatory phase, which is a time which is approximately the first week or so, where the body is healing the area, and it's marked by a lot of redness, and it is just this activity of inflammation. The second phase is called the proliferative phase, and that pretty much goes on for the first month, and it overlaps a little bit with the inflammatory phase. The last phase is called the wound remodeling phase, and that also overlaps with the month of the proliferative phase, and that goes on for up to 1 to 2 years. So when you make observations about healing, it's very important to understand that there are distinct phases, and that you may still be experiencing a normal healing process. A lot of times I explain to my patients is like in the first month, the eyelid incision can be a little bit thick and it'll be a little bit bumpy, and very often people fear that this is a time when they can be developing keloids or hypertrophic scarring, and that they want to go and get something like a topical cream or something to treat that, when actually it's a normal part of the proliferative phase. So to answer the question about smoking, let's just understand what smoking does. Smoking does mainly two things, regardless of whether you're the smoker or whether you are getting secondhand smoke. Smoke causes increases the carbon monoxide level in your blood. Carbon monoxide is not usable by your cells, which in effect depletes oxygen needed for the body to function and to heal. Now, the second part is that smoking causes an incredible amount of inflammatory and something called free radical type of generation, which is destructive to the cells. So if you just think about it, if you look at somebody who's a long-time smoker and compare them to somebody who's not a long-time smoker, all things being equal, gender, age, environment, general state of health, the smoker always very often looks considerably older, considerably more weathered and worn down because they're of those issues. Now, when it comes to wound healing, when you think about it, if you are in some way causing inflammation or depriving the tissue of oxygen, it can potentially have an effect. But I would say that in your situation, it would have been probably more significant early on. But nonetheless, avoiding smoking throughout the healing process is critically important. I would say that most likely a short-term remote secondhand smoke exposure is not likely to have a long-term negative impact on your healing process. I think that most likely it's still better to avoid secondhand smoke. Very often when we ask our patients their medical history, we ask them if they smoke, and then we ask, is there somebody in the house who smokes? And it's already been well documented in the medical literature over and over the negative effects of secondhand smoke. So it is very important that you keep doing the right thing to take care of yourself so that your surgery heals properly, and of course you continue to be healthy and enjoy the benefits of your cosmetic eyelid surgery. So with that being said, I hope that was helpful. Thank you for your question.